It's recording. Don't say anything bad about me.
Thank you. Of course not.
We'll go ahead and get started. So we're recording this now. The dashboard was developed in public health departments here in Arizona, specifically for public health, and we only work with public health. There's about 240 health departments across the nation using our system, a lot of it for accreditation. What the system is an operational planning and execution system. So operational plans come in all forms. Your strategic plan is an operational plan. Your CHIP is an operational plan. The Cycle 8 and the FAB accreditation plans are operational plans. So that's kind of the core of the system. And then being able to monitor those plans and run them through their life cycle using something like the PDCA cycle: plan, do, check, and adjust. We'll talk a little bit more about that in a few minutes here. Turns out when 2011 came along and people were just getting FAB accredited, the health departments we were working with here had a fully demonstrated performance management system, which is the highest level of compliance that FAB offers for performance management. And one of the primary reasons is, and a lot of the reason we're talking to you folks today, is because you can engage all staff. We use what we call real-time planning, which is that automated email notification you may have already seen coming out. That email notification says, hey, you've got some activities or some objectives that need to be updated in the system, and gives you the ability to go back in through what we call quick update to do that. We're going to go into great detail on that. Now, when you get into doing something like your community health improvement plan, you may also have a lot of external partners involved. You can have the emails go to those external partners, and we'll train them, like we're going to do with you today, on how to respond to those emails and how to update the information, so that you're not having to play phone tag with those folks and gather the information and then go back and find the activities to update, that sort of thing. We can kind of short circuit that whole process here. Quick definition of performance management, particularly in public health and in the VMSG dashboard. There's three phases to it. Phase one is your operational planning. So as I mentioned, operational plan comes in all sizes and shapes. The ones you see in the bubbles up there are what FAB calls their 6-pack of plans. These are the minimum plans required for accreditation. So you can see you got your strategic plan at the top, and then your community health assessment, yielding your community health improvement plan, emergency operations, quality improvement, and workforce development plans in there. Now, there's all kinds of other plans in the system as you go forth. There's grant management plans. There's plans for each division, each office, each program in there. You've got the FAB plans in there. You've got the Cycle 8 plans in there. So operational planning is kind of the first step, getting the plans in place. Secondly is monitoring those plans in real time. Based on the fact that we collect data in the background through the real-time planning, we have a fairly real-time view of what's in the system here. We monitor it at 3 different levels. The first level we call the macro level, which is the dashboard screen. So the macro level comes in up here at the group level, the top level of the pyramid. And we're going to go into a little bit more detail on the pyramid here in a minute. But the group level is the divisions, the offices, the programs, and these primary plans that you see up there. So I can look at any level and see the performance there. The micro level is when you're getting down to objectives and activities, where you're actually looking at targets, and you're looking at how are we going to accomplish those targets, be able to look at the performance at that level. And then VMSG Public is the ability to share any of that with the public or with the board or with senior management through a quick, easy to build web page. And then we get down into the performance improvement or quality improvement cycle here, and PDCA, and our nomenclature is plan, do, check, and adjust. So you're going to have the plan, you're going to execute the plan, you're going to occasionally go back in and check and see how we're doing against the plan, and then we're going to make any adjustments necessary, continue through that. And I'll walk you through a live example of that here in a minute. The operational planning model in the system is probably the most common planning model for this type of thing out there. There are some other variations that have different nomenclature and things like that. And when we take people, for any of you who want to go into the next level of training, which is operational planning, we walk you through the various iterations of that. The top of this pyramid that you see is your organization. So it's Detroit Health Department. Underneath that, you have your groups. So groups, again, can be the divisions, the offices, the programs, and then you can have subgroups under that. So you might have community health as a group, and under community health, you might have WIC as a group under community health. In addition, groups can be those primary plans. So your strategic plan is typically a group within itself. So it's the biggest vehicle, if you will. Each group then has a set of services or initiatives. Services are ongoing things. Initiatives are things that you're planning on working on in the future. And they're kind of the buckets of plans, if you will. Underneath each service or initiative then is a set of goals. Goals are a high-level definition of what you're trying to accomplish. The objectives, what we call SMART objectives, SMART being specific, measurable, attainable, realistic, and time-based, are the targets. What specifically are we trying to accomplish in a given time frame? Then the activities are the steps that we're going to go through to get to those objectives. So as you can see, I mean, if you had a bunch of groups in here, and then each group had 4 services or initiatives, and each service or initiative had 4 goals, and each goal had 4 objectives, and each objective had 4 activities, you can see why the pyramid gets pretty wide at the bottom. You could literally have hundreds of activities in something like your strategic plan. So those all have to be kept up to date so that the plan can be moving forward at all times. Now, what I'm going to do now is take you live into the system, and we're going to walk through the development of an operational plan, and we're going to walk it through its life cycle so we can see the various performance monitoring tools, and then we're going to take it through the PDCA cycle to see how we might make improvements on it. So I'm going to tab over to the system now. So down here in our little demo department here, I have the department level at the top of the groups, and the groups are hierarchical. The level number over here indicates the hierarchy. So you see that level 1 is the department. Then level 2, you see the FAB 6-pack of plans. You see a group called administrative services that reports to the department. Underneath there are level 3 groups reporting to admin. So you got finance, HR, and IT. So it's just hierarchy. You can go down to 10 levels deep. Nobody's ever gotten that far, but you could. Underneath this group, we have community health division. You can see we have a group called Tobacco 2023, where we're going to work today. And then we have this WIC. So WIC is reporting to community health, which is reporting to the department. So that's the hierarchy. For right now, I'm going to select my group Tobacco 2023. And what I'm going to do is look at the services or initiatives specifically for Tobacco 2023. So when I selected this group, the next tab down here at the top, services initiatives, is specifically for tobacco. So here you see we have 3 different initiatives. Again, initiatives, we're going to call these future programs, programs that we're just starting to begin here. So tobacco cessation is one, and we'll focus on that today. Secondhand smoke might be one. Tobacco initiation prevention might be one. So these would be the big buckets of things that we're working on. Now, under tobacco cessation as an initiative, we're going to have a set of goals. The goals are a high-level definition of what we're trying to accomplish. So for instance, reduce smoking in high schools, reduce smoking in colleges, reduce smoking in public areas. If you read that, it gives you a good idea of what we're trying to accomplish here. Reduce smoking in high schools. Hey, we know what we're trying to do there. What it doesn't tell you is which high schools. It doesn't tell you when we're planning on doing this. It doesn't tell you how much we're planning on reducing it. So it's an idea of what we're trying to accomplish without the detail at that point in time. Now, at this point in time, we also set the traffic light over here. So the traffic light, you can tab through or click through the traffic light here. There's 4 traffic light values here: green, yellow, red, and gold. Green indicates things are moving along as expected, as you expect a green traffic light. Yellow would be things are slowing down. Something has gotten in our way. Red indicates something came to a screeching halt. Something broke, somebody left the organization, whatever it happens to be. And then the 4th one is a gold bar. The gold bar indicates successful completion of this portion of the plan. So typically in most plans, you're trying to get to successful completion. There's some things that go on and on forever, so it might stay at green, being on track in there. So being able to look at that and say, we're doing pretty good at reduced smoking in high schools. I'm going to leave it at green for today. Down here at the bottom, you have notes. This little button gives you a time and date stamp note. And again, we go into a lot of detail on this when we go into the operational planning training for those of you who want to go to that level. There's also a link down here that's a data source. And this says our data source is CDC Smoking Cessation Fast Facts. And what that is a website that you believe is going to give you the information you need to update this particular goal. If I click on this little link down here, you're going to see it pops open the CDC Smoking Cessation Fast Facts webpage. So the idea is, if this is where I'm going to get the information to keep my plan up to date, and it can be any place. It doesn't have to be obviously CDC. It's at my fingertips, basically. So I can go into here, grab the information, put it in the plan, and away I go. So you got data sources. Pardon me one second. My computer wants to interrupt me while I'm in the middle of all this. There we go. Sorry. Okay. So you've got the notes, got the data sources, and those are at the goal, the objective, and the activity level. Now, underneath this particular goal of reduce smoking in high schools, we're going to go down to the objectives here. The objectives, again, are specific, measurable, attainable, realistic, and time-based. Primarily, by the way, focused on specific, measurable, and time-based. So here's an example. Reduce smoking at Wayne High School by 25% by the end of the school year. So obviously the time base is by the end of the school year. We have a very specific target in here that we're going to measure against is our 25%. So this is our objective. Our objective is the target. This is exactly what we're trying to accomplish. In order to get us there, we're going to assign this person called an objective lead. In this case, Steve Hansen is our objective lead. If I click on this little drop down, I can change that. Now, Steve is the only person who shows up in this window because Steve is the only person assigned to the Tobacco 2023 group. If I want to see everybody in the department, in this case, our little demo department here, I can open that up, show everybody, and pick maybe a new objective lead if I had to do that in here. What this is saying is Steve has two jobs, basically. Go away, Steve. Steve's first job is as a project manager, program manager to get us to this target of a 25% reduction at Wayne High School. Steve's second job is to keep this information up to date. So based on the fact that Steve is designated as an objective lead, Steve is going to get the automated email notification that'll take him right back into this particular objective through what we call quick update to be able to update the status. So how far, what is our current percent reduction? And to get us there, Steve's job is, again, as a program manager, project manager, to get us there. Oops, hang on a second here. Okay, so that's the objective. That's the target. Again, notes, data source, all that kind of stuff is over here. In order to get us to that target, we're going to go through a set of steps, and we're going to look at these activities. There are three distinct types of activities. I'm going to go into a little bit of detail today, but not into great detail. That gets into the operational planning training that we do. But our first activity here is create training content and materials for students and faculty on the dangers of smoking. So think about creating PowerPoints, maybe some videos, maybe some user guides, that sort of thing in here. We call this a project-based activity. You notice there's three types. Project-based activity is by far the most common activity you'll use. It's got an activity, it's got a performance metric. The performance metric is just, how do I know when I've successfully completed the activity? So if we're creating training content, once we've created the training content, we're done with the activity. We've got a date range in here, so a beginning and ending date. And by the way, these things can vary over time. Your date range might vary because COVID happens or something like that. You have to delay this program, whatever it happens to be. So these are some of the things that you might be updating over time. The measurement in this particular case is percent complete. So if you notice down here in our notes field, these are just notes that you're going to put in. Again, you can time and date stamp the notes with this little button here. But in this case, we're saying that we completed chapter 1, and you notice there's 4 chapters down here. So I say completed chapter 1, this is probably sitting at 25%. Chapter 2, maybe 50%. Chapter 3, 75%, and chapter 4 at 100%. So at this point in time, what we're saying is we're measuring it by percent complete. Now, there's a couple other options. There's an option to say, just put a checkbox in here that says complete, which takes you from 0 to 100%. So a couple different options in there. The other thing we do at the activity level, like we did at the objective level, we assigned an objective lead. In this case, we have an activity team and team members. To get there, and you guys are probably going to want to be doing this if you're working on the strategic plan or any of the accreditation plans, is you're going to want to be able to assign your people as the activity team lead members. So I'm going to click on this little pencil icon here. Now, right now, again, it's showing me Steve Hansen because Steve is the only guy in the Tobacco 2023 group. This little black X up here says clear that and show me everybody in the department. So over here on the left, I have 3 columns. Team member, which is exactly that. These are the team of people creating the training content. Diane Cox is our team lead. So she's guiding the team to create the training content. And then that email notification we talked about with Steve, same thing here. Diane is going to get an email on a regular basis. You guys determine what that is. We were talking about that a little bit yesterday with Tiffany. It's probably going to be a monthly cycle, I would guess. So on a monthly basis, you'll get an email. Diane will get an email to come back in and update the status of this activity. So how far along are you in creating the training content would be her update in there. So you're going to have, again, 3 team members, 1 team lead, 1 email notification typically. Over here on the right, if you wanted to, you could use the FTE value, full-time equivalent. And basically what you're doing is measuring the amount of human effort to complete this particular activity, typically only used during budgeting cycles or grant cycles, things like that, to determine how much is this costing us or how much do we need to put in the budget for doing something like this. The FTE values can roll all the way up the pyramid. So I can go back to my activity and say, hey, the 0.1, 0.1, and 0.3 is a 0.5 FTE here. For all 3 of these activities, back to my objective. Down here, it's a 1.0 FTE. So it just gives you the ability to quantify the human investment. Not used a lot, except maybe during budgeting cycles and things. The other thing you have is the ability to add external partners here. So down here, if I click on this little pencil icon, it opens up my list of partners, and these will be obviously your guys' external partners. On the left side here are the partner organizations. On the right side are the contacts within those organizations. So in this case, we're saying Fred Erickson at VMSG Dashboard is our external partner. And as I mentioned, you can make Fred a user in the system, which then allows you to assign Fred the email notification so he can go back in through what we call the partner user interface to be able to go back in and update the objectives and activities for the objectives and activities that he's been assigned in there. So Fred is our external contact. I can have a bunch of contacts in here. I can have a bunch of partners, and I can select as many organizations and as many contacts for each organization as I want to attach to that particular activity. Most often it's, 1 person, but you can have as many as you want in there. So that is our first activity, that, again, the project-based activity, the most common type in there. Our second activity then is what we call a QA or quality assurance activity. You notice the drop down here, QA. This activity is unique in a couple of things. Number 1, it's repetitive. So in this case, we're saying we're measuring monthly. Provide 9 training sessions each month on the dangers of smoking to students and faculty. So what we're going to be doing is going out to the schools, do the 9 training sessions each month. We're going to measure it during, in this case, we're measuring it, looks like starting in September. And then at the end of the month, we're going to start measuring in October and November and going forth. So it automatically moves the data ahead for you here. And secondly, because we have a lot of information in here, we know that we're trying to get to 9 training sessions each month. So what I can say is if we get to 9, it's going to set that traffic light to green. If we get to only 6, we're going to set it to red. We just picked that number. And if it's in between 6 and 9, it's going to set it to yellow. So this is the only activity type, by the way, that sets the traffic light automatically for you. And to set those values in here, every activity has got a wizard here. So I click on that. And our frequency here, you can say, is monthly, but it can be anywhere between weekly and every 5 years. We got a cycle start date here. Then here's the values we set for 9 is green, red is yellow, and automatically calculates in between or 6 is red, I'm sorry. And then in between is yellow in here. My metric is training sessions provided. So it built the performance metric for me. Training sessions provided, measured monthly, are green, yellow, and red. And again, down here, we're going to assign our activity team lead, team members, email notifications. And if we have external partners involved, we're going to assign them as well. You'll notice the value over here is 7. And that's the reason the traffic light is yellow, because it's in between the 6 and the 9. So it automatically set the traffic light to yellow for you. Our third activity then, we won't save that. Our third activity we call a quantitative measurement activity here. The QM activity is very similar to the project-based activity, with the exception that we're actually measuring a quantity here. So contact all 20 tobacco vendors within 1 mile of Wayne High School to ensure they're not selling to minors. So in this case, what we're saying is I can calculate the number by putting in the number that we've actually contacted in here. And then right now it says the total we contacted is 20, and it calculates it to be 100%. So we have a target number in here. Again, back to my wizard. We have a target number of 20 over here. I'm working in decimal versus dollars, and basically dollars just adds dollar signs and 2 decimal points in there. My metric type is tobacco vendors contacted. And then my data entry type down here, it says enter a new value to add to total, which gives me this field and my summary total field. If I change that, you notice the summary total field goes away. So all I'm doing is entering a value. So this is, if I'm going to do something like in a week, and at the end of the week, I'm going to go in and say, hey, I contacted all 20. I don't need to be adding to it on a regular basis here. So that is my three types of activities in the system. So what we've just done in the last couple of minutes here is actually created an operational plan for tobacco cessation. If I go back here to our pyramid, it looks like this. So the group we selected was Tobacco 2023. Of the three initiatives, we selected tobacco cessation. Of the three goals, we selected reduce smoking in high schools. The objective we selected was to reduce smoking at Wayne High School by 25% by the end of the school year. And then the steps we're going to go through to get there. So this is the operational planning process. This is creating an operational plan. The other plans that are in there, the kind of the standard plans for FAB accreditation and for Cycle 8 accreditation, follow exactly the same model, exactly the same levels in the pyramid and all that sort of thing, but they're already in the system for you. Your task then would be to go in, like for instance, in your strategic plan. Your strategic plan just goes down pretty much to the objective level. There's a couple of activities that folks have put in there, but if you're going to say, by the way, you can have it at the objective level, and that's fine as long as you have an objective that you can say, we're done or we're not done with it. But if you have an objective that says we have to go through a set of steps to get to the objective, it makes sense to put activities in there, but not a requirement by any means. So if you want to be able to track your progress towards the objective, you might put a set of activities like we did here: create training curriculum, provide 9 training sessions a month, contact local tobacco vendors. We believe is going to get us to this 25% reduction. So that's what the activities are about. The Cycle 8 and the FAB plans go all the way down to the activity level. Those have already been assigned out at the objective level for sure, probably at the activity level. And what you might want to do if you're the objective lead is to actually go in, just like we did on the activities, and reassign the activities to somebody on your team who you believe is the best person to be completing the activities. Again, that can be in any of the plans in the system here. Now we have a plan in place. Let's go ahead and walk this plan through the PDCA cycle. One of the problems with planning, not just in public health, by the way, in every organization, is that you spend a lot of time and money creating a plan. So let's say you've created your strategic plan, and I've seen your strategic plan is beautiful. You guys did a great job on it. Everybody looks at it and says, yep, this is exactly what we want to do. The problem is if you don't have a vehicle to keep that plan up to date, it's going to sit on the shelf. It's going to collect dust. 5 years later, you're going to go back in and say, did we meet our strategic plan? This is going to make this a real-time process. So you're always in the plan, always working on the plan. So what we just did is created the plan. We know that. Now we're going to execute the plan. So in this particular plan, we're going to create the training content. After we create the training content, we're going to go out to the schools and provide those 9 training sessions each month. In parallel with the training, we're actually going to go out and contact all those tobacco vendors to make sure they're not doing anything bad out there. This is where the real-time training comes in, real-time planning. Real-time planning is that automated email notification. In that email is a link that takes you right back into the system and allows you to go into what we call Quick Update, which I'll show you here in a few minutes. Quick Update system is just a very simplified way to update the activities and objectives that you've been assigned. It'll take you only to those ones that you've been assigned, so you don't have to go looking around anywhere in there. You're going to update those. You're going to log out. Just to give you an idea, this typically takes about 3 to 5 minutes per person per month. So it's a very effective process to keep the information up to date. In an ideal world, you want to spread all of those objectives and activities out to the people who are actually doing them. I call it the horse's mouth. I want to go to Diane, who is actually creating the training content, because she's going to have the most accurate and the most timely answer for updating it. So she doesn't have to go ask somebody else how we're doing on this. She is the person to do. So what you want to do is, again, have those people doing your activity and objective updates in there. So we're going to go ahead and keep this information up to date. By having that up-to-date information, it makes the check phase very easy. The check phase basically is going to be pushing a button. So I'm going to go back up to here and go to back to my objective. So my objective again is, how are we doing against our target of 25%? The easy way to check that is just click this is what we call micro level performance monitoring. This is the performance chart over time. So when we started the program, we were at a 0% reduction. You look up here and it says we are currently at a 25% reduction and flatlined, which is perfect, right? Our plan was 25, our actual is 25. We're right on track. Now back to PDCA. So that was the check phase. If you're collecting that information in the background, it's that easy to do. If you're not collecting that information in the background, You have to go out and collect the information before you can do the check phase. Total waste of time. Next thing we're going to do is go into the adjust phase. There's really 4 scenarios in the adjust phase. The first one you just saw. Everything's working beautifully. We're right on track. Don't really need to change a thing. We're going to continue through the planning phase, kind of skip over that, continue the execution, check it every once in a while to make sure we're still on track, and just cycle through here. Now, let's take, for instance, let's say we got to our check phase and we looked at that chart and we only got to 21%. We capped off at 21%, not 25. At this point in time, we're going to want to make an adjustment. We've got a couple of choices here. Perhaps we were just overzealous on creating the plan. So maybe what we want to do at that point in time is reduce the plan. So maybe the plan 21 is really a more realistic number. So we can take the plan down to 21%, continue through the cycle, trying to stay there, check it every once in a while, just make sure we're still on track here. Maybe it's still at 21%, but we believe that if we threw a little bit more resource at it, we could get it to 25. So the resources we had were the training sessions. So maybe we go from 9 to 12 training sessions a month, if you think that would help. Maybe there's more tobacco vendors out there that we need to contact. So the possibility is to throw more resources at it to get there, to get to that 25%. Maybe there's a whole nother activity we haven't thought of to be able to go out there and do that. So that's, kind of step 1 is no change necessary. Step 2 is adjust the plan if it makes sense. Step 3 would be adjust the resources if we have the resources and it would help. And then there's a 4th option, and that might be adjust the plan and the resources. So maybe we think we could get to 23% reduction, not 25, if we went to 12 training sessions a month. So maybe that's kind of a combination of both of those. So every plan is going through this cycle all the time, and it's fueled by the fact that you're collecting all this information in the background to make it easy to check. You check it, yep, we're on track, continue on, or no, I need to throw a little more resource at this to get on track, whatever it happens to be. So that was micro level performance monitoring, the chart you just saw. Now, we also have macro level performance monitoring. Macro level is the dashboard. So the dashboard is dependent on the particular group that you've selected. So you can have a group and all of its subgroups on one screen. Up here in the top left corner, what we're looking at is the number of traffic lights in each status, currently selected at the activity level. I can also select the objective or the goal. So the bottom 3 levels of the pyramid, I can look at any of them. And basically, I'm looking at the traffic lights here. Now, I also have the number of completed ones, the gold ones down here. The schedule gauge is showing me that I'm aggregately across all of these activities, I am 39 days ahead of schedule. So what it does is calculate based on beginning date, ending date, and percent complete, whether we're on schedule or not. So if I've got a January 1 to December 30th activity or December 31st activity, and today is July 1st, I'm exactly halfway through the schedule. If my activity is at 40% complete, I'm 10% behind schedule. If my activity is at 60% complete, I'm 10% ahead of schedule. So what this gauge is doing is kind of adding all those together and saying, on average, we're 39 days ahead of schedule. So that's pretty good. Down here at the bottom, we can look at various things. One is, when did each of the people last update their information? The green indicates it's been less than 30 days. There's your ideal state. Yellow indicates 30 to 60, which is sometimes okay. You think about somebody being on vacation the last week of the month when the email comes out, maybe it's okay. Red is, hey, this has been at least 60 days. So we need to talk to Steve and maybe train him a little bit more on how to do the quick update, something like that. We also have the roll-up of the FTE by person. So if you've got a bunch of FTEs assigned at the activity level, you can roll them up by person to see how loaded each person is. I've got the number of lagging activities, so calculated to be behind schedule. The days column here is the same as this schedule gauge for the individual person. So how are they doing against their timeline? Overdue says I have activities that are the ending, today is past the ending date, if that makes sense. So maybe the ending date on the activity was September 30th, and today here we are in October. So we're past the ending date and not yet 100% complete. And then the number of red, yellow, green, and gold for each person. So this is a nice snapshot by person. I can also do that snapshot by group. So looking at the groups on the group screen that you saw and potentially all the subgroups down here, again, the same data over here. And then the third one is strategic priorities. So what that does is map the strategic priorities from your strategic plan against every other plan in the system. And what that allows you to do is just to make sure everything you're doing, in fact, does map to your strategic plan. Up here at the top right corner, my priorities. These are individually selectable objectives that you personally want to keep your eye on. Most often they're reds and yellows because they need attention. And most often they're either something you're working on personally or your team members are working on, and you just want to keep them front and center. So it's kind of like a bookmark up here to keep them front and center. These lights change in real time. If somebody's in the background, changes it to green, you can look at it and say, yep, it's done, and you can take it off here. There's a little flag on the objective screen that you can click on and off, and it'll show up here. These, by the way, show up on your login only. So you're going to pick the ones you want to watch. Everybody else can pick the ones they want to watch. They can be same ones or they can be different ones up there. So that's the dashboard screen on your desktop. There's also a dashboard screen now on VMSG Mobile, which is on your phone. Now, VMSG Mobile, for those of you who haven't looked at it yet, is not an app per se. We did that for a reason, because a lot of health departments, and I'm assuming you guys are pretty big, that you have IT restrictions on what you can put on your phone. So what we do is we actually build the app dynamically in the web browser on your phone. So all you need to do is go to the same login, which we'll talk about here in a few minutes, as you do on your desktop. Use the same login credentials. It knows it's on a phone. It'll take you to the mobile version here. So this is the same screen you just saw broken down into 3 phone screens. Top left corner, bottom, top right corner. Everything is clickable on here as well as on the dashboard screen, so I can get right down to the data elements behind it without having to go searching for anything in here. So again, if you're one of those people who's out and about all the time, you want to be able to look at performance of your division or your plan or whatever, it's right there for you. So that was basically what we were going to talk about the system before we get into real-time planning, get into logging in, and talk about the specific plans and such in there. So this is the core functionality. This is operational planning and execution based around the pyramid, as you can see. I am going to take a few minutes here and just kind of introduce you to some of the other features of the system, but I'm not going to go into any detail. And if you do want to get into those details, please sign up for some of the future trainings that we'll be doing on operational planning and performance monitoring in here. So here's some of the other features. Document management. So as you well know, if you're doing any of the accreditation stuff, you've got hundreds and hundreds of documents you got to manage. Documents can be attached to any of those plan elements you saw. They can be attached to groups. They can be attached to people, anywhere you want them. And you can have as many documents, any type of documents as you want up there. Through one of the activity types, the QA activity, you can actually manage those documents over a life cycle. So if you got a standard operating procedure or something like that that needs to be updated every year, you can assign it to an activity. The person who's designated as the activity will get notified. They'll go in and do the updates. They'll upload the new version of the document, all that kind of stuff. So lots of document management built in. All kinds of reports in there. Again, we go into this in the performance monitoring, but basic reports, very, very detailed reports. Anything you want is in there. VMSG Public is the ability to, again, to create public-facing web pages around any data elements in the system. So what a lot of people use this for is maybe reporting to the board on a monthly basis or quarterly, whatever you do. And it's just a real graphically oriented web page with pie charts on there and schedule gauges and that sort of thing that just give you an idea. At our strategic plan, we are really doing well. We got everything in the green and the gold, and we don't have any yellows and reds, and we're on track, that sort of thing. So you can create these, and again, we go into this in the performance monitoring training. Three-dimensional planning is something we go into again later on, and that's all about looking across everything in the system for commonalities, gaps, and overlaps. It's a categorization process. It's very simple, but it gives you the ability to look across and compare things. Real-time planning we'll talk about next, and that is the ability to collect all that information in the background. All the accreditation plans in there, not only FAB, but for you guys, Cycle 8 plans are built into the system. So the entire operational plan on going through the process of Cycle 8 or FAB accreditation is all built into the system here. So now, these are additional features that we would normally cover, but we won't do that for today. We'll go into the future trainings on that. But let's talk about real-time planning. You guys may have already seen the email notifications. I know they've been turned on for every other week on a Wednesday, I believe they were set for. Here's how it works. So if you're designated as an objective or an activity lead, and let's say we set it for monthly, and let's say we set it for the first Monday of the month. So the first Monday of the month at 1 o'clock in the morning, the system goes in and it looks at everybody who's designated as an objective or an activity lead, and it asks 3 questions. Has this person been in the last 30 days and updated their stuff? Has this person got anything that is falling behind schedule? Does this person have anything that's overdue past the ending date? If none of those are true, the emails don't go out. And some of you guys may not have received emails because you were up to date. If any of them are true, however, the emails go out. And the emails, as I mentioned, can go out to internal folks as well as external partners. In that email is a link that takes you back into a login. And again, if you're designated, and you won't get the email if you're not, but because you're designated as an objective or an activity lead, you'll get a notification dialog that says, do you want to go to the main menu where we've been working all day, or do you want to go to quick update? You're going to probably select quick update. There's a pair of screens, activity quick update, objective quick update, because that's all you're updating in here. And it's going to walk you through the update process. I'm going to take you live in there in a minute to show you those screens and show you how easy it really is to do the updates in there. And then you're going to log out and you're going to be done. Again, 3 to 5 minutes per person per month to go through this cycle. So the activities quick update screen looks like this. Now it does look complex because the top is basically the top of the pyramid. So you notice over here, the group, service initiative, goal, objective, activity, says I'm on activity 1 of 29 because it's a demo site. You typically don't have that many activities. My performance metric for the activity. The nice thing about it is when you're inputting this, you only got 3 fields to update. You got the traffic light, so I can, give me your mouse. I can cycle through my traffic lights with my mouse. I can put in my data values, so I can say that I did 9 training sessions this month or contacted 18 tobacco vendors, whatever it is. I can put a time and date stamp note in here. You notice this top one is the date, the time, and the person's name in here. Says it's a test note. So I can, by clicking that little button, I can put the date and time stamp note. So 3 fields to update in here. Hit the next button. You're going to cycle through your activities. You're going to see a similar screen for your objectives. 3 data fields on there as well. You're going to update them. And again, you're going to log out and be done for the month. So the email that you get, if you haven't already seen it, looks like this. So here's those 3 criteria I mentioned. Why did I get this email? Now, just as an FYI, for all of the activities that you personally have been assigned, here's the traffic light status, the red, yellow, green, and gold. Your folks will be showing up in here as the administrators, not our folks in here. So you're going to have the first and last name. You'll have Tiffany and Queasy and everybody in here, the email address and the phone number. The reason for this is I have a question about what I'm seeing here. It doesn't look like this is working right for me. Whatever it happens to be, call those folks, email them, whatever you need to do to get hold of them. And then we talked about a link. This is the link that's going to take you into login on the VMSG dashboard. Now I'm going to walk through the login process 2 ways. Number 1, there's a screen I'm going to walk through that just shows the steps. And then number 2, I'm actually going to go through and do it so you can see what it is. So let's walk through the steps here first. The link, as you just saw, is login.vmsgdashboard.com. That's one option. Option 2, if you can remember, is just to go to vmsgdashboard.com. And then in the top right corner, there's a link that says you're already a system user. Click here. I'll show you that too in a minute. You can go there and it'll take you to this link. There's a dialog box that'll pop up that has a place to put in your user ID and password like every other website in the world. It also has a third button, a send button, which that's saying is send me my login credentials. So you're going to click on the send button. It's going to ask you to enter your email address in the next box that you see. You're going to enter your email, click send. There's a dialog box that pops up. If it says success, that's good. That means it found your information and it emailed you. The email goes out pretty much immediately. So if you don't get it within a minute, go check your spam folder or whatever, because this means that it has gone out. If you don't get the success files, if you get an error or a warning or something, please contact me. I'll get it fixed for you. There's a login button that'll be on the screen after you get this. I'll show you that in a minute here. You click on that. This time you're going to enter the user ID and the email address out of the email that you get. I'll show you what that looks like here in a second. You're going to enter your password, and then you're going to hit login. Just as an FYI, your login user ID, you don't have to remember if you don't want to. If you just want to use your email address as your user ID, you can use either. You can go back and forth. You're not going to lose the thing here. Then you're going to log in. So the email will look like this. So here's the login information. There's your user ID. Typically, it's first name dot last name, and then your password. I can tell you, if you haven't logged in before, your password is going to be a crazy cryptic string of characters, kind of very secure, I guess. So what you're going to want to do when you enter your password is probably just copy and paste it out of the email, because some of the characters are hard to tell what they are. And I've had people had that problem before. So you're going to go in and change that. I will show you how to log in, and I'll show you how to change that password pretty easily, but it's going to look like this. Now, let's go in and walk through the process here. So this big red button at the top, the power button up here, is my logout. So I'm going to click on that. I'm going to say log off. Now it's going to take me to the VMSG dashboard homepage. This is the link I was talking about. Already a dashboard user, log in here. So I'm going to click on that. It's going to open up my login. So this is the send button I was talking about. So if you already have your credentials, like obviously it has mine in there. If you already have them, you can just log in. Otherwise, go to the send button. Now it's going to ask me for my email address. Oops, hold on one second. My computer's talking to me again here. Okay, so I put in my email address. I hit send again. I'm going to get hopefully the success dialog. It says your user ID and password have been emailed to you, and then the email you just saw is going to look like that. So now I'm going to go grab that email. I click OK. I'm going to go back to this login button up here. Click on that. Now it's going to allow me to go ahead and put a different one in here. Put in my user ID and password. Again, I can either use my username or my email address up here. So if you don't want to remember a new username, typically it's pretty easy. Like I say, it's first name dot last name typically. But if you just want to put your email address in there, that's fine. I would copy and paste the password out of the email and then click login. Now, because you are a designated activity or objective lead, you're going to get this dialog. I can cancel out if I wanted to just log out now. I can go to the main menu, which is where we've been working all day, or I can go to the quick update screen. I'm going to go ahead and select quick update. What that's going to do is take me to the, well, if I'm designated as an activity lead, I'm going to get the activities quick update. If I'm only designated as an objective lead, it's going to take me right to the objectives quick update. This is the activity quick update screen. As I mentioned, the pyramid is up here in blue. So this is just context. Gives you an idea of where am I. I'm in the strategic plan or whatever. In this case, I'm in the FAB 2022 local demo plan here. Again, down here at the bottom, I can cycle through my traffic lights. There's 4 clicks. I can put in my new data value in here. I can put in a note. If I want a time and date stamp, I click this guy up here, and then I'm going to hit the next button. It says I'm on activity 1 of 8. So I'm going to go ahead and cycle through my activities here. 5, 6, 7, 8. Okay, now I'm on activity 8 of 8. If I've also been designated as an objective lead, when I click this again, it's going to say, hey, you want to go update your objectives? I'll say, sure. Click on the objective box. It's going to show me a very similar screen, but with the objective up where it belongs ahead of the activities here. So up here you see the objective. Again, three data fields. My traffic light, my data field, my notes field, again, time and date stamp if you want it. And you notice the objective is above the activities. So these are the activities that make up that objective in here. Now, the reason that they show up on here, and by the way, you'll see one of them is in blue and 2 of them are in gray. The one in blue is assigned to you. So you're not only the objective lead, you're also the activity lead for this particular activity in there. What that means is, by the way, that you just went through it in the activity quick update. So you don't necessarily need to update it again. The gray ones are assigned to somebody else. So probably somebody else on your team you assigned them to, and maybe they're on vacation and you want to update them anyhow. So I can bring those in and go update them myself in addition to what the other person would do. So it just gives you the ability to look at all of the activities related to that objective. And again, it says I have 1 of 1 up here. Now I talked about changing your password. So when you're on the quick update screen, it's this key button up here. If I click on that, it's going to say, and again, copy and paste out of the email the current password, put in whatever new password you want, verify it like every other website in the world, and hit update, and you're all set to go on your new password. A couple other things you have up here, and you'll be using this a lot during the accreditation plan, so both Cycle 8 and FAB accreditation. This is document management. So up here, I'm going to go up and say, I want to add a document. What am I looking at here? My tobacco cessation plan or something. So I'm going to click on this. This blue button is on pretty much every screen, so you can attach documents anywhere. I'm going to attach a document to this particular objective. So I'll click on that. Again, it's an empty screen. So I'll click here. It's going to say choose a file. I'll just go pick a random file off of my computer here. Let's see, VMSG test. See if I have anything fun in here. I'll just call it the CHA. So I'll put the CHA in there. Open that up. The name will appear here in a second, and then I say upload. Now it's uploaded the CHA, so I'm just going to put now the file name appears down here, but a lot of times you want a better description. Sometimes file names can be a little bit cryptic here, so I'm just going to say USA Public Health CHA. I'm going to say it's green, it's completed, ready to go, and we'll say final document. Ready for submission. My CHA is typically a 5-year document, so I can go in and say put in what 28 in there maybe. So this is the expiration date of the document down here. So what that allows me to do is put documents in here. I'll go ahead and save it now. So I've updated, or I've uploaded this document in here. It's uploaded on our secure server, so it's always going to be there. It shows it's version 1. I can have as many versions of a document as I want in there. Typically, when you're putting documents in for accreditation, you'll use the traffic lights like this. What you'll say is if it's a yellow traffic light, it means it's a draft. And you can have as many versions of the draft as you want up there. If it's a green light, that means like we have here, we're ready for submission. We have completed it at the department level in here. And then once it's uploaded to EFAB or to the state, then you can go in and mark this as gold. So it gives you a nice way to control the documents and understand where you are in the process. There's also a way on the main menu for the administrator and manager users to be able to actually get in there and look at all the documents, for instance, that are being submitted for cycle 8 and look at the traffic lights and say, oops, here's a green one, means we haven't submitted it yet. You go submit the document, you turn it to gold, and you're all set to go here. So again, that's document management available on Quick Update as well as every other screen in the system here. This is the main menu button. If I want to go back to the main menu, this is my help screen up here. I'll go over that in a second. I can go to my next objective, although there's only one, so it won't go anywhere. Let's go ahead and go back to the main menu here. So now, if I wanted to change my password from my main menu when I'm logging in, this is exactly the same screen as you saw before. So I can change it in here, current password, copy and paste in there, new password, verify new password, and away I go. So that is the quick update. That's the login sequence. There is a document that I know that Queasy and Tiffany have that is the login process. If they can't find that, I can send you a new version up here. But just have it's a PDF document that walks you through that exact same process we went through. Now, in addition to being able to do your updates on your computer, you can also do them on your phone. So we got kind of a pair of screens, a little less context as you can see, but still, here's my activities, here's my objectives. Everything else works the same. I can update the notes, traffic light, data value, next, and get through to my objectives, same thing, update them, next, and I'm done with that. So again, you can do that. So, here's an example I use. You're driving into the office in the morning. It's that first Monday of the month. You stop at Starbucks to have a coffee. You're sitting at the table, pop open your phone. Here's that email from VMSG. Okay, I'll go ahead and click on the link in there, bring up my quick update, go through and do my updates on my activities, do my updates on my objectives, log out, I'm done for the month. So it's just kind of a nice convenience feature in there. Now, if I'm doing anything in the system and I want to get help or information on it, let me take you back here. It's this button up here. So let me go to my services tab here. So I'm in my services tab and I have a question about, what are these buttons for, or what am I supposed to be doing, or how do I add something? How do I remove something? Just go to the blue eye up here. Click on that. Takes you right to adding and managing services, as you can see. Over here is just kind of, I call this the left-brained approach. It's just a set of steps to go through. So to add a service, click the plus button, enter the service, save it, blah, blah, blah. Just walks you through everything in there. In addition to that, this is about a 5-minute video-based training module on adding and managing services. So I can go through that. Pops open in a new window. It's like I say, it's just a video training module. This guy down here is the entire user guide. Everything you see in here in one PDF file. And it is a hyperlink PDF, meaning that the table of contents is clickable, so I can go to services initiatives. In fact, in this particular case, it'll scroll me right down to that document. If you like to, you can print it off if you like to have printed stuff. This document down here is the implementation guidelines. So it's just a bunch of stuff that we've learned over the years from our clients about what works great, what didn't work so well. Here's some of the IT things that we've run into. Here's some of the things you do to get people involved in the system, that sort of thing. So it's a worthwhile read if you're just getting started with the system. In addition to the training we're doing today, which is basically this one at the top, the introduction, these are video-based training modules, total of about 3.5 hours, I think, if you go through all of them here. The basics is the next one, operational plan development and training, and performance monitoring training. If you like to do things on your own scale, they're pretty much exactly the same training as we go through live, but again, it's video-based training. So if you want to do those, feel free to do them. If not, we'll be doing these trainings for quite a while to come now, get all the basic stuff in there for you. So I'm sure that Queasy and Tiffany will let you know when the next trainings are if you want to enjoy them. But again, if you want to do them yourself, they're all based in here as well. So that was pretty much what I wanted to go over today. Are there any questions, anything that you'd like to see that we haven't touched on? Queasy, is there anything I left out?
No, that was quick, Fred, but I think you covered everything.
Okay. Again, any of you who want to get deeper into the system, we will be scheduling some additional operational planning training and performance monitoring training. And we'll, I'll have Queasy and Tiffany put out the word to everybody that the trainings are coming up, and if you can fit them into your schedule, that would be great. We'd love to have you as deep into the system as you can possibly be.
Fred, there's another training that's scheduled for next week. Can you just go into a little detail in regards to what that will cover?
Let me take a look here. I think Andrea probably set that up, and I'll have to look. Basically, what we were going to do is we were going to have people, now that they've been through the training, actually go into, for instance, the strategic plan or any of the accreditation plans, get to know the plans a bit. Maybe if you are assigned as the objective lead in the strategic plan and you want to add activities, feel free to do that based on what we went through today. Just add your activities in there. And then what we're going to do next week is basically do a review. Answer questions. So, some people will get in there and say, well, I couldn't figure out how to do this or do this, or I added these activities. Can you look at them and see if they look okay and that sort of thing. So that was kind of the plan, is more of a review, like we did with the operational planning, the review.
Yeah.
So, and you guys are all welcome. Please go in and figure out the, particularly in the strategic plan, go in and figure out the objectives that you're assigned to. Decide if you need to add activities to them. If you do, please go ahead and give it a shot, adding those in there. Assign yourself or your team members as the activity leads and team members in there. And then if you have any questions, by the way, you're always free to reach out to Queasy or myself or Tiffany to get your questions answered as you're going through it. Okay, if there's no more questions, I will let you guys get on with your day. And if you do have any questions, again, please feel free to reach out to me. Here's my contact information right here.
Thank you, Fred. I really appreciate it.
Okay, thank you. See you all later.
Thank you.
Enjoy your cool weather.
Thank you.
Thank you. Bye.
Bye-bye.
Thank you.